set on dying and I didn't have time for the medicine to work, ECT would be the treatment, because it's gold standard for treatment for depression. It works very, very well. But the antidepressants, there has been some recent publicity about these, okay? And I guess recent, I mean in the last few years. The FDA had put together all the studies from, and bear with me with this, I'm going to give you the story, but it may be that I just have to sum it up at the end and give you the nuts and the sort of the short version, because it gets kind of confusing. But the question was, is there a higher risk when you first start an antidepressant in the first few weeks of suicidal thoughts or behaviors or completed suicide or any of this stuff? So the FDA says to all the drug companies, send us all the antidepressant studies that you have, where you looked at kids first, and then adults with depression, plain depression, clinical depression, and you've compared your drug to sugar pills, placebo. Okay, and let's look and see, is there a higher risk of suicide in the placebo group, the sugar pill group, or the drug group? Okay, what they found was that with the adolescents, the kids and adolescents, there was a 4% risk of suicidal ideation and behaviors. Again, these are, when I say behaviors, these are self-injurious behaviors. This is all that stuff mixed together. So it's not clear what the intent was, but these are kids who may have tried to hurt themselves, carve on themselves, whatever. And so there was a 4% risk on the drug of the folks taking antidepressant, the kids, and a 2% risk in the placebo. So it's small risk, but it's still there. It's twice what it was for placebo. So the FDA said, we're a little worried if we put some language in the PDR about this and warn doctors and patients and families about it. We're a little worried that people are going to stop using antidepressants, but we still think we should do that because there looks like there's a little bit of a risk. So what they did was they said, you should weigh the risks and benefits before you use these in kids. Okay? We should do that with anybody. We should always do that, right? So if they're very depressed, and the other thing is, you should monitor these kids very closely when you start the medicine, because it's usually in the beginning that there's going to be an issue. So you monitor them very closely, and the things you look for are signs that might signal you to them getting more risk for suicidal stuff. The anger, the mood changes, the anxiety, the sort of agitated type stuff. Okay, so they take the antidepressant and they're depressed, and now they're kind of agitated. They're not sleeping. They're just restless. They can't, they're agitated looking. Okay, those are the ones that probably are higher risk for something, for having a suicidal ideation or something else. Now remember, I said 4% and 2%. There were no completed suicides in any of those patients. Okay, thousands of patients, no completed suicides. So it's not showing that there's a higher risk when you start the antidepressant that more people are going to die. That's not what it's showing. It's showing more people might have thoughts of hurting themselves or carving on themselves or something like that, but not death. Okay. The thing you've got to keep in mind is that the risk of death from untreated depression, remember what I said it was? 15%. Okay, that's high. That's much higher than using the antidepressants. Okay, so now that's a kid's story. Okay, now this year, and actually just December 13th, the FDA had put together. They looked at all the adults. They looked at all the same stuff, but this time they looked at adults instead of kids. Okay. And again, what they found was less than age 25, it looks like there may be a higher risk of that there's a higher risk than sugar pill of the suicidal ideations and behaviors. Again, not completed suicide, okay, but the behaviors, less than 25 years of age. Between 25 and 30, it was equal between sugar pill and drug. Over the age of 30, the antidepressants were protective. There were less problems with suicidality than there were in the placebo group. When they got above 65, extremely protective. As a matter of fact, if you're not using an antidepressant in that age group for treating depression, you're not practicing standard of care if you don't use them. So I think the key is really in any age group you need to monitor your patients, but especially those less than 25. Now, why is that? Is there something inherent with the antidepressants that are making these folks worse? Nobody knows. The FDA didn't know, and they actually called an advisory committee of experts that are, not drug company folks, but these are unbiased people, experts in the field, to figure it out. And nobody's absolutely sure. There are a lot of theories being proposed, and I think two that make the most sense to me are, one, that if you think about a person less than 25, their brain may not be fully wired the way it should be yet. Okay? We know that in adolescence, their brains are changing dramatically. They're getting pruned. The brain is getting pruned quite a bit. And it could be that there's some pathway or some pruning going on that is putting these folks at higher risk for suicidal thoughts and things when they take the antidepressants. Maybe it's as simple as impulsivity, right? How many adolescents are impulsive? A lot, right? I mean, none of them think really about the consequences of what they do before they do it. They just do it. And then, and so that part of the brain, whatever makes them impulsive like that, might make them more likely to, try to hurt themselves or do something like that. So that's one theory. The other theory is, these are young people. What if they're bipolar, but all you're seeing is the depression? So they're so young that the only episode, you don't see mania, you don't see the highs. All you're seeing is the low. Well, you don't have any other way of knowing if they're bipolar disorder. I mean, usually when I take a history, I'll ask one of you guys, have you ever had times where you've been really high, where somebody said you look like you're on speed, or a soccer mom on meth, or something like that, and they'll say yes or no, and sometimes you have to ask the family, because people themselves, they like feeling like that, so that's no problem to them. But anyway, with a kid, it's hard because they haven't lived long enough maybe to have an episode of mania. And so you're treating the depression, you start them on an antidepressant, and you make them worse, like I just said. You don't want to use an antidepressant alone in a person with bipolar disorder. So maybe some of these kids are actually bipolar, but we're not able to pick that up. Our diagnosis is not, all we can do is ask symptoms. We don't have blood tests and brain scans and all that stuff to do. So that makes it very difficult, and I think that those things could be what's going on, and that could explain why the younger population is more at risk than the older population. But in general, not treating depression is way worse than treating depression. And so I guess that's sort of the take-home message. And then finally, I'm all done here, but I wanted to show a couple of things. One is a couple of suicide hotlines, if anybody's interested. And I don't know if you can focus in on that. It's probably not going to show up real well from a distance, but these are suicide hotlines that, of course, if people have family members that are in a crisis situation, or hopefully maybe not so crisis, but enough that they have time, they can call somebody and talk to them about what to do and that kind of thing. That's what these are. I can read them out, I guess. The first one is 1-800-273-TALK, which is 8255, and then the bottom one, this may be even easier to remember, is 1-800-SUICIDE. And that number is 1-800-784-2433. So those could be helpful to someone at some point. I'll turn this when you're done copying here. All done? Okay. And then finally, I put up a couple of websites. The first one is the American Association for Suicidality, and it's www.suicidology.org. Let me make sure I got that. That's right. And then the National Institute of Mental Health, and it's www.nimh.nih.gov. And it has lots of links. And actually, this is a good one for about any kind of brain illness, psychiatric illness that you're interested in. There's a lot of information there about all these different things, but suicide included. So, now, does anyone have any questions? That's a lot of talking there. No questions. All right. Well, yeah.
I have one, David.
Yeah.
What creates a mind that would go suicidal like these terrorists did?
Well, that's a good question. I've never interviewed somebody that went through something like that. I don't have any personal experience at all with it. Near as I can tell, this is totally without seeing any of them, but I think that they don't view it as, I don't want to live anymore. It's not like they're depressed and they're saying, I don't want to live anymore and everybody'd be better off without me. It doesn't sound like that's what's happening. I think what's happening is from just watching the news and all. So it's it's not a very good professional opinion. But I think that they've been told and taught